Hello and welcome to today's topic, Fear of Recurrence. My name is Jodi Puhalla and I'm one of the oncology social workers at Ironwood Cancer and Research Centers. So fear of recurrence is the experience of worry and concern that cancer may return for a survivor who has moved beyond their initial treatment phase. The level of fear varies for all survivors, and some individuals do not experience any fear at all. So what are some triggers that people have shared with me? A lot of times when there's a time for a scan, a lot of people have fears about going to that appointment. It triggers the time that they had their first scan and maybe didn't get the best news. Things on social media and on the news may trigger some fears. An impending doctor's visit. Most people say they have their routine visits after they've gone through all their treatment, and even though they might feel optimistic, there's still this kind of nagging fear. Pain or similar symptoms that may be new in their body sometimes can really trigger fear of recurrence. And then if a loved one or a friend or someone in their community has been diagnosed, this can really trigger some feelings. There's a term called scanxiety that was new to me, and it's actually another term used in the oncology world. Common symptoms are increased heart rate, irritability, sweaty palms, and nausea, and one can experience trouble eating or sleeping, moodiness, or simply feeling out of control. What are some things that you can do for scanxiety? Well, talk about your concerns. Sometimes just giving it words and putting it outside of yourself can really help the anxiety. Really identify the physical symptoms that you're feeling. Sometimes people journal about this, or again, share what specifically is going on. And seek support. Mindfulness practices and tactile activities, meaning using your hands or physical types of activities, can really help the anxiety. And be kind to yourself. If you feel like you're really judging yourself over these feelings, just know that it's a very common thing. Then there's something called guided imagery, and it's focused relaxation that allows your imagination to create a calm and peaceful image in your mind. This is a form of mindfulness that is very helpful to a lot of people and can be a useful coping skill. Studies have shown that your body has the best potential to heal when it is in a state of deep relaxation and positive focus. Research on guided imagery has indicated numerous physical benefits, including regulated heart rate, lowered blood pressure, improved respiratory function, decrease pain, and minimizing symptoms of depression, reduce fatigue, and a balance between body, mind, and spirit. Did you know that we have many free mindfulness classes here at Ironwood Cancer and Research Center? We have things like Reiki, Tai Chi, guided meditations, breathing, art classes, a variety of classes. Reach out to our supportive care services team and we can let you know and give you more details about that. Sometimes you may need more help and need to reach outside for that help. Sometimes the worry or anxiety can get in the way of your relationships and daily activities. Sometimes that fear prevents you from going to your follow-up care appointments. Maybe you have hopelessness or apathy about the future. If you have difficulty sleeping or eating well, not participating in activities that you used to enjoy, and maybe you have trouble concentrating or making decisions. Some people have the feeling that they have nothing to look forward to, or maybe you're being unusually forgetful. If you're experiencing any of these feelings, it might be a good time to seek therapy. A good place to find local mental health professionals is www.psychologytoday.com, and you can find a therapist or mental health professional in your area. There's another term I'd like to introduce you to. It's a rather new term that came post-pandemic, and it's called post-traumatic growth. Post-traumatic growth is defined as the positive psychological change that is experienced because of the struggle with highly challenging life circumstances. So what we're saying is sometimes we equate post-traumatic stress, obviously in a negative way. But sometimes people do experience post-traumatic growth, where there's some real changes within a person. A lot of people confuse resiliency versus post-traumatic growth. Resiliency is when you begin to adapt well in the face of adversity, trauma, tragedy, or significant sources of stress, and you learn through the experience. Post-traumatic growth takes it a step further, when the positive changes experienced actually result in a life-altering way. And after learning the valuable lessons through resiliency, one thrives like never before in one's life. Now, if you're not experiencing this, don't feel bad. It's something that many people have difficulty with. But what are some of the things that people can strengthen in their lives to reach post-traumatic growth? Keys seem to be having a strong support system, obviously, like friends, family, resources, like we have here at Ironwood. Certain personality traits, like being an extrovert and openness. Now, if you're an introvert, that just means learning to share and seek out comfortable social connections. Optimism and future focus play a part as well. The ability to integrate the traumatic experiences into your life and not getting stuck and assimilating the experience into their lives. That means not diminishing what you've gone through, but really integrating it into your life and realizing, if I could survive all that I went through, I know that I can do it in the future. They develop a new belief system after the traumatic experience. So sometimes people really have a shift in the way that they look at the world, and they see it as a very positive gift. Being able to find the benefit from traumatic events. Now, like I said, this doesn't always happen, and it's not always easy, but I have met some very inspiring people that actually see their trauma as a gift because they become a better and stronger person. Although fear of reoccurrence is common, it doesn't make it any easier to live with. If you're a patient at Ironwood Cancer and Research Center, please reach out to someone from the Supportive Care Services team. That's what we're here to do, and you're never alone. Thank you.